Well, good morning, everyone. We are just getting ready to start our Tuesday, February 16th edition of the biweekly COVID-19 situational update. Very pleased to have you with us today. Hope you are warm and not too buried in snow wherever you are. I will kick us off with a land acknowledgement. Okay, so today we respectfully acknowledge that Peterborough Public Health is located on the Treaty 20 Mississauga territory and in the traditional territory of the Mississauga and Chippewa Nations, collectively known as the Williams Treaties First Nations, which include Curve Lake, Hiawatha, Alderville, Scugog Island, Rama, Beausoleil, and Georgina Island First Nations. Peterborough Public Health respectfully acknowledges that the Williams Treaties First Nations are the stewards and caretakers of these lands and waters in perpetuity, and that they continue to maintain this responsibility to ensure their health and integrity for generations to come. We are all treaty people. Okay, with that, we will invite our board chair, Mayor Andy Mitchell, to start us off with some opening remarks. Please go ahead, Andy.
Thanks, Brittany. Today marks the end of the provincial lockdown and stay-at-home orders. Thank you to all our residents whose cooperation in staying at home and only undertaking essential activities has led to the significant decrease in new cases in our community. It is important that we keep vigilant and continue to contain the pandemic. The change to yellow status should not be seen as a signal to return to pre-pandemic behavior. Please continue to be cautious and follow guidelines. For businesses and other public operations, it is important to adhere to safety procedures. Create, maintain, and post a safety plan. Adhere to reduced maximum occupancy levels. For bars and restaurants, reduce hours as required. Conduct the appropriate screening of employees. Record the name and contacts of clients when required, and encourage adherence to public health guidelines. Additional local measures may be put in place as circumstances warrant. For individuals, please continue to adhere to public health guidelines. Do not assemble in large groups. Wear a mask when away from home. When with people outside of your household, maintain a physical distance of 2 meters. Wash your hands frequently. And if you are ill, stay home, seek medical advice, and get tested. Together, we will keep our families, friends, and neighbors in the Peterborough region safe. Stay well, be safe, and in all things, be kind. Thank you.
Thank you very much, Andy, and great way to start us off with that nice summary of us arriving in the yellow zone. So now I will invite our Medical Officer of Health to share with us the latest situation in terms of COVID-19 statistics. So please go ahead, Dr. Salvatierra.
Thanks very much, Brittany. Well, it was a very busy weekend for our case and contact management team. As of 4:30 p.m. yesterday, we have 22 active cases, so that's an additional 6 since Friday. But there has been quite a significant change in the number of high-risk contacts that we are following. It's 205 compared to 64 last Friday. And I'll explain in my later remarks what accounts for this dramatic increase. In total, we have reported 579 cases since the pandemic began. 548 of those have resolved, and the number of local deaths from COVID-19 remains at 9. Last week, we reported, next slide, please. Last week, we reported 21 new cases. Most of these became known to us over the weekend. So you can see how quickly things can change. Our consistent decline in weekly case counts has ended. So I'm glad that we have moved to yellow and not to green. And I strongly urge all residents to take public health precautions seriously now that the stay-at-home order has ended. Next slide, please. This graph shows our epi curve, and it has flattened slightly as the second wave wanes, but still too early to predict whether this will continue. Our next slide shows our exposures, and you can see the trend continuing in terms of local exposures, contact with a case being the largest source of exposure by a considerable margin over other sources. As far as testing, we continue to test about 450 new people each week. So that brings the total number of residents who have been tested at least once to 42,500, or 1 in 4 residents. For our active outbreaks, glad to report that we are now down to 1 active outbreak, and that is at Peterborough Retirement Home. It remains stable. The outbreak at PRHC was declared over this past weekend. When we look at the map of Ontario, we can see that our local incidence rate is now standing at 14 cases per 100,000, which is up from last Tuesday, when it was only 9 per 100,000. This map reflects the cumulative case incidence rates across the province and does not pertain to the color-coded provincial framework. Our rate since the pandemic began stands at 391 cases per 100,000 compared to the overall provincial incidence rate of 1,923 cases per 100,000. So in response to the evolving number of cases provincially that have been infected with a variant of concern, public health has enhanced our case and contact management of all COVID-19 cases in an effort to prevent the spread of variants in our communities. In essence, we are not waiting for confirmation of a variant, but instead proactively have embraced a more intensive response as an effort to prevent that transmission. And this is part of the provincial 6-point plan that was introduced earlier this year. What this means for Peterborough is that we are using a lower threshold for classifying any contact as a high-risk contact, which involves both the requirement to self-isolate for 14 days, but also a requirement to test twice during that period, once immediately and then once again on or after day 7. This partially accounts for the significant increase in high-risk contacts identified this past weekend. These were associated with recess exposures of school cohorts, where we were unable to accurately assess the degree of contact and therefore used a precautionary approach to dismiss all of the recess cohorts. Going forward, any high-risk contact that develops symptoms will be treated as a probable case until test results are available. That means that we will initiate contact tracing even before we have those results. The household members of contacts who are self-isolating are now required to stay home except for essential reasons like grocery shopping or attending a medical appointment. And any household members of a contact that becomes ill while in the incubation period will now need to self-isolate until the results of COVID-19 testing are available. In addition to these enhanced case and contact measures, I am reminding all Peterborough residents not to travel outside of our area or to have family or friends visit, as this will help to hasten the arrival of the variants here in our community. I am recommending to all municipalities that facility bookings be limited to Peterborough area residents only. And although many businesses are opening today, I wish to remind everyone that we must wear our masks and keep at least 2 meters distance from anyone outside of our household group. So while shopping, that means you must wait until others are out of the way before you make a move. If you can't wear a mask for medical reasons, my best advice to you is to not shop in person and instead shop online and have groceries delivered so that you don't put others at risk. Face shields can be used as an accommodation, but please remember that they don't work as well as masks. New restrictions that have been added to the Reopening of Ontario Act mean that you are not able to dine or to shop with anyone outside of your household group, as you are now personally accountable to keep 2 meters distance at all times from others who are not in your household. This means that you can be charged for non-compliance. So this is not the time to visit with friends or to meet them at a restaurant. Sitting at a table to share a meal or a beverage should only take place with your household members. I am actively reviewing with our legal counsel the potential for using my authority under the ROA or the HPPA to make it abundantly clear to everyone in Peterborough that we must be extra cautious in light of the real and present danger of facing a third wave of this pandemic before we have the benefit of vaccine protection. And speaking of vaccines, we're not expecting a shipment of vaccines until next week. So I am going to defer my remarks about the revisions to the priority groups for immunizations until we're with you again on Friday. I would also like to share some good news, and that is the overwhelming response to our call for volunteers to support our mass immunization clinics. So far, more than 600 people have registered with us to volunteer once we start phase 2 of the vaccine rollout. My team is just processing these submissions now. For those still interested in signing up to help over the summer and early fall, please go to the career section of our website where you'll find the online form. I'm so grateful to our community for this strong show of support, and it makes me proud to see everyone pulling together to get us through this next important step in keeping us all healthy. Thanks very much.
Thank you very much, Dr. Salvatierra. Okay, now we are going to invite our elected officials to share a few words. I see we have 3 on the line today, and I would like to invite our municipal reps to start first. Let's start with Mayor Diane Therrien from the City of Peterborough. Do you have any comments to share today, Mayor Therrien?
Hi, Brittany. Thank you so much. Not too much to add other than it is exciting that our small businesses get to reopen this week. But again, we need to remain vigilant. We need to make sure that we're staying home if we're not feeling well. Basically the same, public health guidelines that we should be all well familiar with going on a year now. The city is working to reopen the canal and other facilities so that people can get outside. But again, we need folks to be abiding by public health guidelines when using those facilities so that we don't have to restrict access to it, if there are too many people using them or if we have complaints about that. So I'll just leave it at that for now, but I'll be available for questions if needed. Thank you.
Great. Thank you so much, Mayor Therrien. Please, you could join us today. Okay, I'll now invite our County Warden, J. Mary Jones, if he's got some comments to share. And if your camera's working, I'm happy to put you up on the screen.
No, my microphone is working, so I'll give you a treat and not have to put me on the screen. Not a lot to add other than what Diane said. Of course, our municipalities are all scurrying, trying to get arenas open to the best of their ability to let our young hockey players kind of get back to the real world. And I do find it interesting that we all should remember is that rental of our facilities should be kept to our local population. So I hope everyone takes that piece of advice into account. Other than that, again, thanks everybody for what they're doing. We're here just kind of being part of the team. So everybody, please stay safe and let's all do ourselves a favor and listen to the advice we're given. Thanks, everybody. Miriam, I know Miriam's going to go on a lot longer than I did. There you go. Thank you.
Okay. Thank you very much, Warden Jones. Okay, we are now ready to hear from MP Monsef. And also, if your camera's working, I'm happy to put you up on the screen. So take it away, Miriam.
Thank you so much, Brittany. Yes, my camera's working. Hello, everybody. Bonjour, Anin, salam alaikum. I join you from my home in Peterborough, Kawartha on Mississauga territory, and I truly hope that you found some comfort and some rest in Family Day yesterday. Many thanks to Board Chair Mitchell and the entire team, Dr. Salvatierra at Public Health, for being proactive, for being on it, and for very quickly interpreting the guidance and the changes that are being made into applicable behavioral tips and direction for the rest of us. I know many businesses and many services appreciate you being on top of it as you are. I'll keep my comments today to vaccine travel restrictions and the gun legislation that was tabled in the House of Commons today. On vaccines, we're working to get as many vaccines as quickly as possible, and after some temporary delays, deliveries are ramping back up again. Pfizer is making its largest delivery to date and an even larger one next week. We remain on track to receive 4 million doses from Pfizer, 2 million doses from Moderna before the end of March. Deliveries will increase significantly in the spring and summer, and by the end of September, Canada will have received 84 million doses of these two vaccines. That's why we can say with great confidence that every Canadian who wants a vaccine will receive one by September. On travel, last week I provided a quick update that all travelers arriving to Canada by land, with some exceptions, are now required to provide proof of a negative COVID-19 test result taken in the US in 72 hours pre-arrival, or a test taken 14 to 90 days prior to arrival. As of February 22nd, all travelers entering Canada at the land border will be required to take a COVID test on arrival and toward the end of their 14-day quarantine. Also, as of the 22nd, which is not that far away, travelers arriving to Canada by air, with some exceptions, will also be required to take a COVID-19 molecular test when they arrive and quarantine at an approved hotel for up to 72 hours. They will also need to take another test toward the end of their 14-day quarantine period. To be clear, as of February 22nd, all travelers entering Canada will be required to take a COVID-19 test on arrival and toward the end of their 14-day quarantine. On gun legislation, this morning, legislation was tabled in the House of Commons. We are back to build on the ban on assault style firearms that had been used to commit violent crimes, including in the tragic shootings in Nova Scotia, which took the lives of 22 innocent Canadians. The ban includes more than 1,500 models and variants of assault style firearms, none of which restrict the activity of hunting and farming, which don't require military style rifles. Today, we introduced legislation to further these measures, which include a voluntary buyback of newly restricted weapons and further limitations for those who choose to keep them. Tougher penalties for gun smuggling and trafficking, as well as municipalities having the ability through bylaws to ban handguns if they choose, are part of this legislation. Lastly, we are in the yellow zone that we have all worked so hard to get to. Some restrictions are lifting, but let us not take a single bit of this for granted. We are not out of the woods yet. And in fact, we need to keep doing what we've been doing even better so that we can get through to a better spring and a better summer. Many thanks to the 600 plus volunteers who've stepped up to help with vaccine rollout. This is what makes Peterborough so special. This is why I'm hopeful about the future. And I very much agree with the wise man who once said, we are all in this together.
Oh, I think you froze a bit there at the very end, Miriam, but thank you so much for your comments. Okay, we've got lots of media on the line. Thank you so much for joining us. I see about 8 reporters, so I will be calling you out individually. And we will be starting with Paul Rellinger from Kawartha Now. So if you have some questions for Dr. Salvatierra, Paul, please go ahead.
Thank you so much. And actually, just a couple things for Dr. Salvatierra, if I may. You mentioned that city facilities or facility bookings are going to be limited to local. And that's something that obviously there's some control over from a city perspective. I just want to get your thought on businesses. We've heard talk about businesses perhaps refusing customers or from out of the area. I guess a couple things. I guess they're within their rights to be able to do that. But what advice, if any, are you giving business owners who approach you and say, is this a good idea? Can I do this?
So they are able to restrict access since it is private property, but we are in conversations now with our legal counsel to see whether or not we can introduce some measures to assist businesses so that they're not just doing this on their own. So we are looking into it. I think though, really the onus is on us, not to travel, and on people outside of Peterborough not to come into the region. It really shouldn't be up to our businesses. I think we all have to take responsibility to try and reduce, especially now with the variants, to try and reduce the spread of this much more transmissible and potentially deadly form of COVID-19.
Okay, thank you so much. And just one more thing, Dr. Salvatierra, I mentioned at the last briefing, and I think you said you would look into it or maybe you'd get an answer. I'm not sure if you had, about close contacts who go on to develop a positive case of COVID and if that will be reported. And I'm just wondering if that's still on your radar or.
Mm-hmm. Yes, it is, Paul. We've certainly raised it with our team of epidemiologists who are supporting our case and contact team, and I think they're looking into it. So we'll get back to you on that. But we are looking at it.
Okay. All right. Perfect. And I think that's it for me, Brittany. Thank you so much. Thank you, Dr. Salvatierra.
You're welcome.
Great. Thank you so much, Paul. Okay, let's hear from Taylor from Peterborough this week. Go ahead, Taylor.
Oh, excellent. Thank you. Just a question of clarification, first of all, Dr. Salvatierra. You said that close contacts in a household are being treated as probable cases. That's correct?
No, close contacts of a high-risk contact are being asked to isolate and only go out for essential purposes. And if any close contact that develops symptoms, now we will treat them as a probable case, even while we're waiting for their test results, and which would mean that their household contacts are then all considered high-risk contacts in that period as well.
Okay.
Does that make sense?
Yes, I believe so.
Okay.
All right. Just wondering if, because I am still seeing some confusion as to, what people can do now the rules have loosened, what people should be doing. I'm just wondering if you might be able to kind of rhyme off some quick can do's and can't do's right now for this current phase of restrictions.
Well, you can now shop or get your hair cut or visit a gym, but you're going to have to wear a mask and you're going to have to keep those 2 meters of distance. If you and your household members wish to dine in at a restaurant, you can do that now as a household group. You are not able to do that with people outside of your household. So there are more activities that are open for people now, as long as they follow those public health measures.
Okay, that's
so
good.
You can go get a haircut, Taylor.
Oh, I desperately need one. Yeah, and I think too, how can people follow along? Because if the rules ease back into green zone, or if things happen to get worse and we go into orange or red, what's the easiest way for people to find out information on what they can and can't do, aside from following along with local media?
Visit our website. I would say, I mean, we currently do our best to get the information out to all of the partners and the different stakeholders and sectors. We do provide them with guidance. However, if you think you may have missed something, I'd say check our website, and we will have the relevant information there.
Okay. Just a couple of questions in regards to this increase in close contacts over the weekend. So this was a case of a school recess cohort, and all of these people are currently at home until they test negative then?
Correct. Well, so they've been dismissed, and we are treating them as high-risk contacts, which means many of them were tested over the weekend. And because now with the enhanced measures, we test twice. We test in the early days once the contact is identified, and then we will test again at day 7 or after in the incubation period while the high risk contact is self-isolating. So we have 2 cases in a school, which means that several cohorts were impacted, but these 2 cases are not linked. These 2 cases were exposed outside of the school, which is why we have not declared an outbreak in that school, but instead have identified any and all high-risk contacts, and we are keeping them out of the school so that it is safe for others to continue to attend.
It's not my microphone that's popping, is it? Okay. So these individuals who were in the recess cohort and they need to test negative twice, after that 7th day where they've tested negative again at that point, would they be okay to return to the school then?
No, because they still have to stay out for 14 days. That's the incubation period for COVID-19.
Okay. And this is the practice that will be used that has been used and will be used for any other cases in schools as well. So if there's another recess cohort, we can expect another kind of large batch of close contacts to be sent home then?
Unless the school is able to keep the cohorts distanced. And I understand that is actually a challenge for schools, given that they have only so much outdoor space and only so much staff supervision. So because of that, there are multiple class cohorts using the outdoor space during a recess, and recess continues to be then a time where potentially we may have to dismiss several cohorts.
Okay. I think that's all the questions I have today. Thank you so much, Dr. Salvatierra.
You're welcome.
Great, thank you, Taylor. Okay, let's hear from Matt Latour from our local radio station, Freak and Oldies. So go ahead, Matt.
My question's for Dr. Salvatierra. I know the last, I'd say, 2.5 weeks or so, we've seen a pretty steady decline in the number of active cases, and then that kind of rised up again this past weekend. Is there any idea as to what caused that? Could it be something like Super Bowl gatherings, anything along those lines?
Good question, Matt. I don't have that level of detail, but again, most of our cases over the weekend were already identified as high-risk contacts of other cases. So we're seeing that spread from person to person, and much of it occurs before people know they're sick or before they feel sick. So it's just another example of how difficult this virus is to contain until we are immunized and are able to prevent its transmission. So what we saw on the weekend were high risk contacts becoming ill with COVID-19. And then because of that, in our efforts to clamp down, we saw the large number of high-risk contacts now that are in isolation as we speak.
I think it was just over a month ago, you said sometimes it was tough to track some of the close contacts or source of exposure because people were gathering with so many different groups of people. Is that still an issue, or has that kind of resolved itself in the last month or so?
We had seen quite a drop in the number of high-risk contacts that people had been identifying. So my impression was that we were getting good compliance with the stay-at-home order and the requirement of reducing socialization to household members only. The big change, of course, is that we now have schools with in-classroom attendance. And because of our practice of dismissing an entire cohort, whether it's on the bus or in the class or at recess, we're going to see larger numbers of high-risk contacts again that are associated to in-school exposure. So I think that's what we're seeing. That's what happened over the weekend.
That's it for me. Thank you.
You're welcome.
Okay, great. Thank you so much, Matt. Okay, I'd like to welcome back Donelda Fraser from the Havelock Rail. I see you're able to join us today, Donelda. Did you have any questions for Dr. Salvatierra that you'd like to ask?
Yes, I do, actually. On the news last night, they said that Havelock Belmont Methuen School have COVID cases.
Mm-hmm.
Due to a small community, we seem to have a chain of how many are actually active and how many aren't. And due to the fact that we only have the rail going out once a month, it would be of benefit for the residents of our township to know how many active cases are coming from the school and if all those families are being isolated.
So I'm not sure I completely understand your question, but I'll just try. I mean, in the school in Havelock, we had 2 cases identified, both students in the school, but they were exposed to a positive case that was not in the school. So the transmission that occurred in a social setting outside of the school. In the school now, all of the class cohorts associated with those 2 cases have been dismissed. And we are following all of them as high-risk contacts. I think the best news to give your readers is to assure them that we follow up. Public health follows up with every case, and we will follow up with any high-risk contact. And we do that quickly, within 24 hours. So they will hear from us if they've been identified, and all they need to do is follow our instructions. So we have public health nurses and that will provide guidance for that period of time. We will also let them know when they can be discharged safely back into the community or back into the school. The other important measure that, Donelda, that I think I would recommend is that people download the COVID Alert app and have it activated on their phone. If they're really concerned about the possibility of being exposed, that app will ensure that they get instant notification as soon as someone has tested positive, and then activates the alert. So that's I think a really good way for everyone to help keep themselves safe. Does that help?
Thank you very much. That does answer my question.
Okay.
I did have another one, but because I don't want to take up a lot of your time. Do we have the variants in our townships, like in Peterborough County?
Not that I know, Donelda. Right now, what happens is that every positive case of COVID-19 gets screened for the variant, but it takes about 2 to 3 days for a result. So right now I can tell you that we have not been notified that any of our cases have the variant. That said, there's a 2 to 3 day period where a wait time. So I can't, I won't know until it's in hindsight. And that's my concern, is that the variant, the province did what we call a point prevalence study back in January, where they tested every single specimen that was done on that day. And according to those results, what they found was that there was about 1.1% prevalence of the variant across the province. And even though we don't have it here, because it's so easily transmitted and because the doubling time is so quick, my worry is that someone will bring it into Peterborough, or that someone from Peterborough will be exposed somewhere else. You don't have to drive very far to go to an area in the province where there has been documented evidence of the variants, and then just bring it back. That's how easily transmitted these variants are. So it may be a matter of time, but for now, I'm hoping we can work together to try and delay that as much as possible, so that we have time to immunize more of our vulnerable residents before we have the variant here.
Okay, thank you very much.
You're
That's
welcome.
all I have.
Great. Thank you so much, Danelda. Okay, let's hear from our examiner colleagues. Joelle Kovac, go ahead.
Okay, Dr. Salvatierra, have there been any store charges this weekend or lately?
I have not heard of any charges, Joelle, but we can have, Brittany can follow up and get back to you on that. So not that I'm aware of.
Okay, is that school entirely dismissed then? Like, is it small enough? No, okay.
No, we've only dismissed the impacted cohorts.
Okay. And you said next week for vaccine?
Yes, so we are expecting a Pfizer shipment next week. We expect it to arrive on the, well, we don't know for certain, but we're prepared to ramp up our immunization next week, potentially on the Wednesday or Thursday. And I can provide more information on Friday as we get closer. We'll have a little more certainty.
Oh, great. Do you have any idea how many doses are coming, or who the priority people are?
Well, again, we will need to get confirmation, but right now we're expecting approximately 6,000 doses in the shipment, and we will continue to immunize with the phase 1 priority groups. So we will continue to do staff and essential caregivers in our long-term care homes. We'll begin our highest priority for healthcare workers. We hope that we'll have enough vaccine to take out and start our other seniors congregate settings, like our retirement homes, for example. And we're waiting for some word to understand better if we can use it to begin our adult Indigenous groups, or whether that will be best for the Moderna. We also are in quite urgent need of additional Moderna vaccine. Joelle, we have to do a second dose of Moderna in the long-term care home facilities. We need to do that starting next week. And so we are hoping this week to learn more about whether we will be getting Moderna and how many doses as well. So I'm hoping I'll have a better picture for next week's immunization rollout by Friday.
Oh, wow. Let's hope those Modernas come then. Why is Moderna preferable for the Indigenous population? Is that freezing purposes? Like, is that logistics, or?
It's logistics. It's easier to move around than the Pfizer. We now have it's better. We have some guidance about moving the Pfizer, so we can move it out of the freezer, but it has less stability than the Moderna. Once the Moderna is thawed, you get 30 days of stability as long as it's kept refrigerated, where for the Pfizer, it's much shorter. I believe it's only 5 days. So the Moderna is a more stable vaccine. And in course or communications with First Nations and other groups, the province has identified the Moderna vaccine as the one that they are hoping to use in First Nations communities. That's what's being used in the remote First Nations communities in the north. So we expect it to be Moderna, but that said, it is possible to do it with Pfizer as well.
Thank you so much. That really helps. And the last thing I wanted to know about was, I understand that Board of Health is asking for sick pay, and I think it has to do with the younger cohort in Peterborough that's been ill more often than anyone else. Can you talk briefly about why that's sick pay is needed for them?
Definitely. So when we look at our largest group of infected cases in Peterborough by age, it is the 20 to 29-year-olds. And when we look at our socioeconomic status, the data that's voluntarily given at interview, we see that a greater proportion of this age group is a low income. So they are dependent on low income jobs. Many of these jobs do not have any benefits like sick pay. So we know from interviewing these cases that many have gone to work when sick because they felt they had no choice. And that's because they are so dependent on their income to pay for their housing or to put food on the table. And so they continue to work even though they were symptomatic. It's my understanding and my opinion that if we had better access to paid benefits, that these people could stay at home when they were sick. And so that based on that, the Board of Health has decided to advocate for paid sick days during a infectious disease emergency like COVID. And they are writing to the Premier and to the Minister of Labor, as well as the Minister of Health, to make their views known. So I believe that letter is on its way. And will hopefully it'll help make a difference.
Okay, thanks very much. Please carry on.
Okay, thank you very much, Joelle. I also wanted to provide you with an update. I did hear back from our Manager of Environmental Health, Julie Ingram, asking the question about any more store charges this weekend, and the answer is no, we did not lay any more over the weekend. So I'm just going to check in with Reg Watson from the Examiner. Did you have any questions today, Reg, or is it fine to just proceed with Joelle?
Yeah, that's fine. Proceed with Joelle.
Okay, great. Okay, let's hear from Trent Radio. I believe, is that Rob? Are you on the line? Did you have any questions for Dr. Salvatierra?
Yes, it is. Thanks, Brittany. Just one question, I guess a clarification for Dr. Salvatierra. You mentioned that you were looking at the possibility of seeing what powers you had and working with council to bring more orders in. You mentioned one, I think, was around the providing support or powers to businesses to restrict access to people from outside of the area. Are there any other sorts of orders that you're considering that you'd be prepared to mention?
I'm also looking into the possibility of instructing the need to instruct restaurants and bars to only seat people from the same household. So we're looking at the feasibility of that as well. So stay tuned on that one as well.
Okay, perfect. Thank you very much. That's all from me.
Okay, great. So our final reporter, we have Jessica Nisnik from Global News. So go ahead, Jessica.
Thanks, Brittany. Hello, everybody. Hello, Dr. Salvatierra. Forgive me if you've mentioned this. I'm sure you hear that a lot these days. Did you say when we'll be reassessed to potentially move to another color?
So the province in its background documentation has said that it would be every 2 weeks. So we can expect to stay at yellow for a period of at least 2 weeks before we might be able to move down. Now, moving up can be quicker, especially now that the Chief Medical Officer of Health has been given an emergency break and to be applied. And so we can quickly move up, but we won't be moving down very quickly.
And, you know, what would be the main difference if we went to green? Like I feel like with yellow, we're allowed to do so much. Is there anything, the loosening of restrictions, what would that include just loosely? Like what more could we do?
What more could we do? Well, Jessica, I must say I have to go and check because I've been reading all of the regulations with yellow in mind, and I haven't been paying much attention to the green, but I can certainly look into it and get back to you.
Okay, and I can look too. I just find sometimes I'm like, what are the differences? It's so slight sometimes, and I feel like I said, yellow, we're allowed to do pretty much everything, it feels like. There was one last question. So I know you started the long-term care homes at different times. You did them on different days, but relatively within 3 weeks. What is the deadline? Did you say it was 28 days? Is that how far we can stretch it? And when is that 28 days cycle over for the first round of residents?
So with the Moderna vaccine, it is 28 days. And so we will need to begin our immunization with the second dose next week, towards the end of next week.
Okay. I think that's everything for me. Thank you, Dr. Salvatierra.
You're welcome.
Okay, great. Thank you so much, Jessica. I think that wraps us up. So appreciate everybody's time today, and we will see you back here on Friday. Please stay warm out there. We did issue a frostbite alert earlier this morning. It's going to get very cold this evening. So we look forward to having you back on Friday. Okay, take care. Bye-bye.
Thanks,
Thank you
everybody.
so much, Brittany.